This is your Houston chiropractor, Dr. Gregory Johnson. We have Jennifer here with us this afternoon, and Jennifer has been, this will be her second visit here. She came in last week and had her first adjustment. Tell them how you did after your very first adjustment with your back pain.
It was pretty incredible. The pain totally went away just immediately after my adjustment, and I haven't felt it since. And then
now she's getting some compensatory issues because we're changing her biomechanics, so she's starting to feel some aches and pains on the opposite side, which is very normal. She's in transition right now from the old alignment to a newer biomechanical alignment, so it's very easy and common to get sore and stiff in muscles that you're using now that you haven't been using most of your life.
Right.
Now, she has a significant forward head posture, which is creating this little hump in her upper back. A lot of people have that. It's called Dowager's hump. So what we're doing with chiropractic adjustments is we're bringing her whole head up over her thoracic spine to get her ear back over here over her shoulder. That'll take care of this T1 prominence, which is the Dowager's hump look. And then we're going to line her entire spine up today and body. And we talked about some exercises with Jennifer today too. Okay, I'm gonna have you close your eyes and bend your head forward and backwards. See, people are always, in our lifestyle today, forward. Take it back to neutral. So see, her head's a little forward and over to the right. See, I can tell she's been a side sleeper a long time because her head's forward and to the right of center. And you know, we're doing this all day long on the computer or texting on the phone or bent forward taking care of the children or whatever it is you're doing. Most people are in flexion. Flexion is your enemy. Extension is your new best friend besides me. All right, so I'm going to have you come over here on this table first, and we're going to decompress your spine. Robin McKenzie is a physical therapist down in Australia who developed a series of extension exercises called the McKenzie approach, and that's what we recommend our patients to do at home is extension exercises on the floor. I'm putting a little extra padding around these till we get our new pins. This is going to feel tight. There you go. Now, last time that you got your adjustment was the very first time you'd ever had chiropractic care, right?
Yes.
Yeah. And did I do a thorough history and exam on you?
You did.
Yep. Okay. That's a really important part about treating patients. There you go, home run. I don't have to ask if you felt that all over you. Okay. Now, there you go. Just keep breathing. Let me have you. Okay, let me do it. If you try to help me, it's gonna hurt. Tilt your right ear to your right shoulder. Better. Okay. It's easier said than done, huh? Let go. But a very important part about diagnosing patients and formulating the appropriate treatment protocol is do a thorough history and examination on the patient, which I do before we ever start shooting these YouTube videos because there's too much privacy stuff in the history and exam, so I don't do those. It's going to your tummy. Now see, her right leg is short by about 1/4 of an inch today. Was a 1/2 inch the other day, and it gets even when I bring it up. That probably tightened up a little bit on that right side. So her right SI joint's out. That's called a positive Knockless and Deerfield test. So I'm going to start adjusting her right SI first, which is where you've been having that compensatory pain, right? Then the sacrum on the right. Sacrum in the center, SI joint on the left. Now I'm going to drop this piece out here and I'm going to be adjusting L5 straight straight P to A in the Z-axis. This is what restores the lumbar lordosis. Okay, keep breathing. That a girl. There we go. Okay, you're going to feel your head popping up a little bit. Now, she's lost the cervical lordosis as well, so I'm adjusting her cervical spine right here at C3-4, C5-6. Slide down this way just a little bit for me, a little bit more. There you go. Down here at C5-6. See, I'm restoring the cervical curve. Now I'm down on T1 to put her whole head back up over her thoracic spine. Let's go on your back now, please. And that's what I'm doing with this adjustment as well. Slide up on the headpiece just a little bit, Jennifer. There you go. So see, I'm not adjusting her cheekbones. I'm actually using these as levers to bring her whole head up and back in the Z-axis and rotating on the X-axis to get her ears. And for Nate, if you can get a side shot here, you can see her ears now are in line with her shoulders and even a little behind that. So I'm going to have you put your arms straight out to the sides for me now. Okay, slide down about ½ inch. Perfect, good. So now I'm adjusting her AC joints on both sides, her sternoclavicular joints on both sides, and then her costosternal joints up here on the sternum and the ribs where they meet the sternum, because her mid-thoracic spine is subluxated. So that's a vertebral, costovertebral subluxation. You can rest your hands on your tummy. Yeah. There we go. Now you should have felt that from your ankle all the way up to your pelvis. Pulled your shoe off even. That a girl. Good. Feel that one up there too?
Yes.
Okay. Here, I'll get your shoe back to you. There we go. Okay, let's sit you. Face that away, please. Got a nice cold front coming through Houston right now. It was down at 57 here this morning. I know that's not cold for a lot of you watching, but it's cold for us Houstonians. All the women are wearing their winter coats in this morning. You didn't, though.
No.
Good.
I'm okay with it.
Yeah, me too. Now, see, you should feel your head held up a little higher already.
I do.
Good.
This feels a little looser, too.
Yep. There we go. Crack Eyes gonna love you. That's cavitation addicts. That's the cracking noise you hear when you get adjustment. I'm not calling you a crackhead. Standing in front of you. Alright. Now, I'm going to have you close your eyes and bend your head forward and backwards again for me, please. Now, that should have felt a little smoother already.
Oh, yeah.
Okay, back to neutral. Okay, see her ear is now right here over her clavicle rather than being in front of it, so we're moving it back about ½ inch, but this is how we're going to get it back even more, and this is the exercise that she needs to do at home. 15 repetitions 3 times a day. Lift your shoulders straight up. Simultaneously pull them backwards. Flare these way back like this, palms facing forward. See how that tightens up that whole trap? Okay, now your head's a little forward and to the right. See, so we want to bring it straight back in the Z-axis.
Okay.
And then to the left on the X-axis. And then look back at the wall behind you on the X-axis. You'll feel a little tap right there. And there. Now relax. Now when you do that again, Jennifer, tell me if this feels even smoother than the previous one did. Smooth as silk.
Yeah.
Back to neutral. Okay, her ear's still over her clavicle here, so she needs to really do those exercises 45 times a day, 15 in the morning, 15 around lunch, and 15 in the afternoon or early evening. And then extension is your friend, flexion is your enemy.
Okay.
And everything. And that goes for y'all too. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.